Brain is a very complex organ. It is made up of very specialized cells, which are there many in number. And these all cells, they work in an electrical fashion for normal function of the body. And when these electrical activity are disturbed, they come as recurrent episodes of a behavioral abnormality in a human being. And these are called as a seizure. Seizure is a single phenomenon, and epilepsy which comes into many attacks. Now, let us talk about epilepsy in children. Epilepsy in children is a very common condition, many a times which is being overlooked by many physicians. When to attend these patients and when to treat, how to diagnose these patients is a big question. The most commonest form of epilepsy in children is the febrile seizures. The febrile seizures occurs with a high setting of a fever where the fever is about 101. Now, what happens during this seizure in a child is most important to understand. Now, if the seizure continues for more than about 2 minutes, there are some irreversible changes in the brain. If it is less than 2 minutes, probably we may not need to do at the same time. Probably we can prevent the occurrences or the reoccurrences in future. Now, let us understand what is or what are the causes of seizures in children. The most commonest is a febrile seizure. Sometimes the seizure can be triggered by intercurrent infections or some of those triggering factors in pre-existing disorders in the brain. Now, they can be a developmental abnormality, or sometimes a mild fever can trigger a pre-existing or developmental migrational disorders in the brain. Now, how do we identify this? So, we need to have a detailed information about the seizure. That can be obtained by patient itself, or it can be obtained by a witnessee who witnesses the event. Now, what are the information we require of an epilepsy or a seizure? Now, we need to have information prior to an attack, during an attack, and then after the attack. How it begins, how many minutes it lasts, and what is the behavioral changes child does during the attack. By this, fairly we will come to know whether the seizure is arising from a particular part of the brain or is it from all over the brain. So, here the approach changes. Now, the particular part of the brain seizure is induced, then we have a certain treatment for this. If it is a generalized one, we have a different approach for this. Now, this epilepsy, having diagnosed or started on a treatment, how does it influence a children or a society in overall view? If you understand, we have a lot of myths in our country. Epilepsy is a wrath of a god. Sometimes it is an old sin which is in the past, and it is a result of that. But it is not true. We all know, we have understood by many scientific ways, the seizure is caused by a particular disorder in particular area of the brain there. So, identifying this is most important, and we all know it has become a social problem in our society. And treating this, we can avoid learning disabilities, we can avoid catastrophic events in future. Now, there are many ways we can identify this by electroencephalography, by EEG, what we call that, or CT scan, MRI, PET scan, etc. Now, we have advanced to such an extent that we can go for a genetic study, identify the other family members who are subtle in clinical picture. We have batteries of drugs available, and we are able to overcome many problems in epilepsy induced complications, and we are able to avoid many complications as well. Uh, the most important is, many a times we do see some conditions where epilepsy is presented in different fashions. Likewise, many a times I see in my clinical practice parents coming to you saying that, okay, my child is not able to study in class. He keeps complaining about a headache. Sometimes he goes blank. At times he suddenly falls on the ground. These are not a very usual manifestation of a seizures, but we have to be very keen and then understand these symptoms can be a manifestation of a seizures as well. So with all that available batteries of investigation and the clinical acumen, I think probably we need to concentrate and identify disorders at the earliest. Mainly I practice in OSC Medical College. I am a professor in neurology. I do my clinical practice, private clinical practice in Matoshri as an epileptologist and a general neurologist. Thank you.